Hello, hello, ladies. Happy Monday. Can you believe that it's the end of the month of September? This is my birthday month. It was the 17th and now it's gone by. Goodbye. Oh my goodness. I can't even believe that. How time just flies by all the time, ladies, all the time. And now we're going into October soon and we're going to get ready for winter. I'm not looking forward to winter. I really love it when it's really springtime. But what can you do? It is what it is, and we just have to deal with it. But it was nice to have my birthday month to be celebrated, and, that's always a good thing. So how was your weekend, ladies? I hope that you had a great weekend. I hope that you enjoyed yourself and that you took time for you, that you literally took time for you this past weekend. And I want to promote that because it's so important. Now, my next thing is you are fantastically beautiful. Why do I say that every time? Is because I just find women to be beautiful. I just think that we are such a powerhouse. I would say that we're all Wonder Women. And I just think that no matter what size or how we look, what color of our hair, I think that we're absolutely beautiful. And I hope that if no one told you this today, I hope that I'm the first one. And I hope that you understand that you will always be beautiful to me and society because we are women. So you can't get any better than that, right? So you are listening to the Estrogen Chronicles, Her Plate, Her Power. I am your host, functional nutritionist, Gail Thorpe. I'm also a health detective. How about that? At your service. So I want you to sit back and I want you to grab your pen and paper because I like to give as much information as I can and I want you to take it down so that you can be informed and you can refer back to it. So grab your pen and paper, get your coffee, your tea. If you want to get a little glass of wine, you can do that too. I want you just to relax and let's get into it. So since we are leaving the month of October, one thing that is observed in this month of October is gynecological cancers. And I did not want to totally leave out this month without observing that. Okay? That's so important and it most definitely pertains to us. So let's talk a little bit about this and some things that we can do for screenings and things that we can do as far as eating and what are some of the symptoms, the whole thing. So actually, what exactly is considered gynecological cancer? It actually refers to cancers that begin in a woman's reproductive system. Now, these cancers start in different organs but are grouped together because they affect the female reproductive tract. Okay. Now, some of the different forms, let's talk about that. So one of the forms is cervical cancer. So that starts in the cervix, which is the lower part of your uterus. And then you have ovarian cancer that starts in the ovaries. And then you can have uterine or endometrial cancer, which starts in the lining of the uterus. And then we have vaginal cancer, which starts in the vagina, or I always say V-spot. And then you have your vulvar cancer, which starts in the outer genital area. And then we have fallopian tube cancer. Now that can sometimes be considered rare, but it can happen. Okay? Now you see how much that pertains to us, right? Because we all have that, all of these different parts, okay? So what are the common symptoms that you can have that you want to look out for if this is something that possibly could be happening? Like I often mention in anything that I talk about, symptoms sometimes can overlap, meaning that certain symptoms are very similar to other symptoms. So this is why it's important to get screenings. This is why it's important to see your healthcare provider if you notice any kind of unusual changes in anything. So I always like to bring that to your attention, ladies, because that's so important. So symptoms actually can vary based on the cancer type, but here are some of the things that you definitely want to look for. So if you have any type of abnormal vaginal bleeding between periods or after intimacies or post menopause. So any type of persistent pelvic pain or pressure. If you have bloating or feeling full quickly, which could be a sign of ovarian cancer. If you have unexplained weight changes. If you have pain during intimacies. And if you have unusual itching or burning or changes in your vulvar skin, this is time now that you want to pay attention and to see your gynecologist. Okay? So if when seeing or experiencing rather these type of symptoms, some of the things that you also want to make sure and look forward to, if you notice persistent, unusual symptoms, especially bleeding, pain and bloating and discharge also, is a time to see now the gynecologist, to see your doctor. Okay? If you have a family history of gynecologic cancers or genetic mutations like BRCA1, 2, which is testing for any type of cancer mutations. And check with your insurance company, because a lot of times if you do have a family history of any type of cancers, whether it be breast cancer or gynecological cancers, a lot of times that particular test, BRCA1, 2, can actually be done for free. But you want to check with your insurance company to make sure. Okay? Okay. Now, some of the things that the doctor will do, your gynecologist would do, will be a pelvic exam, okay? And they will do also a pap smear and an HPV test for cervical cancer screening. And then you'll have a transvaginal ultrasound for to take a look further into your ovaries and your uterus. And then there's a possible biopsy. So that will be, of course, tissue samples for confirmation. You'll have possible blood tests, like, for instance, CA-125 for ovarian cancer, and of more imaging. So you'll have a CT scan, an MRI, a PET scan to check to see, God forbid, if any of these cancers have spread with you. Okay? So that's what you're going to definitely look for if that's what's happening and that's what's going on. Now, some of the possible treatments that may be suggested if you are positive for any of these cancers, it may be a surgical removal of the tumor or organ if needed. They may consider radiation therapy for you. They may consider chemotherapy for you. So it all depends now with your gynecologist and your oncologist, which would be the cancer doctor, and hematologist, which will also test your blood and see exactly where you stand. You'll have targeted therapy. So it also can be drugs aimed at a specific cancer cells. And then you'll have immunotherapy, which actually helps to stimulate the immune system to help you to fight cancer. Okay? And a lot of times they will often do a combination approach, and it can also depend too on the stage and the type of cancer. So they may do a little bit of both. They may do some chemotherapy. They may do some targeted specific drugs at the same time. They may do immunotherapy also. So it really just depends on what the decision is with your health professional that will be overseeing your situation. Okay? Now let's talk a little bit about screenings, okay? Because that's the other important caveat of everything, is to get screened. So screening is extremely important for any type of gynecologic cancers. And if you're looking at cervical cancer, for instance, you want to start screening between the ages of 21 to 29. Get your pap smear every 3 years and HPV testing. Okay? Now that may not be routinely needed as yet, but that may be something they may do depending upon many things, your history and some of the results that they may see. Okay, but you want to take a look at that. Okay. Also, between the ages of 30 and through 65, you want to get your pap smear every 3 years, or your HPV test every 5 years, or your pap smear and HPV co-test every 5 years. Now, if you're over age 65, if you had normal results for the last 10 years, you may stop screenings unless you're at a higher risk. Now, this matters because almost all cervical cancers are caused by HPV, and pap HPV tests actually can catch the changes pretty early. So that's why that's important for cervical cancer. Now, for ovarian cancer screening, there's actually no routine screening for the average risk of a woman who basically, if you have a high risk for women who are, have already taken the BRCA1-2 mutation and the family history testing, right? So they may have a transvaginal ultrasound plus a CA-125 blood test every 6 to 12 months, starting at age 30 to 35. And then also sometimes preventive surgery is also recommended for ovarian cancer. Okay? And make sure you guys are writing this down and paying close attention because it's so important. And then for uterine or endometrial cancer, there's really no standard routine tests. Women at average risk, you want to pay attention to abnormal bleeding, especially after menopause. And women at high risk, which has a family history of Lynch syndrome, okay, there possibly may be some guidelines recommend annual endometrial biopsies starting at age 35. Okay? Now, for vaginal and vulvar cancer, no specific routine screening beyond the pap smear, which may pick up vaginal cell changes. Your best prevention is regular pelvic exams and reporting any itching, burning, or skin changes. Okay? Now that I hope that you are really paying attention to. Everything is based and contingent upon your family history, your lifestyle too, so you want to definitely pay attention to any type of thing that you are feeling that's different. And like I said, if you notice, some of the symptoms that I just mentioned have been very similar to some of the things that I mentioned when you have possibly fibroids. You have unusual bleeding, right? You sometimes have very heavy bleeding, and sometimes you have bleeding between your periods. So this is why if you go and get your regular pap smears like you're supposed to, get your regular wellness exams like you're supposed to, which is basically your physical, to really make sure you stay proactive on your health and also monitor yourself. Monitor yourself, ladies. Now, how do we take back our plate in a situation of gynecological cancers? Now, I want you to understand that these are suggestions as far as some foods that can definitely help. But I am by no means in recommending this alone will be the answer, because I also believe, like I said, I don't want you to, if you're having symptoms and if you feel that eating certain type of foods is going to eradicate the problem. That is irresponsible to think in that terms. Eating good foods, as you always know, when I say, will definitely help situations, but you also have to combine that with getting tested and checked out as well by your health professional, especially when you start to notice changes. But foods that can help us in the situation of taking back our plate and getting the power back, which will certainly help if, God forbid, if you are possibly about to deal with having something like this or for prevention. So, you know, my cruciferous vegetables like broccoli, kale, and Brussels sprouts, again, it helps to detox. I talk about that pretty often because we need to be able to help our liver to detox the excess estrogen, because that just gives you a lot of problems when there's too much hormones like estrogen that's floating and recirculating in your system. You have to be able to detox it. And you can detox it with those foods I mentioned. And there's also a supplement called DIM, okay, that also can help as well. All right. Berries, which is rich in antioxidants. Turmeric and ginger, which is anti-inflammatory. Because when we are so inflamed for a long period of time, that is also can be a breathing ground to help those cancer cells to come alive, right? Because it could be dormant, but continuous toxicity, inflammation, a stressful lifestyle, all of those things can contribute to making a cell that is dormant come alive. Green tea, which has the polyphenols to help fight free radicals, okay? But again, with green tea, you have to be careful because if you're taking certain medications, you cannot drink green tea at the same time. So you want to make sure that there's no type of contradiction there before you even start, okay? Garlic and onions, which is immune boosting, and omega-3 rich foods like salmon, chia, flax seeds, all help to reduce inflammation. Inflammation, we do not want to have high inflammation in our body, okay? Because that only, like I said, is a precursor for causing other inflammatory things to go on. So we want to bring that down and we want to detox. Very important. Now the foods. A lot of this you've heard many times and you know where I'm heading. So highly processed meats like bacon and hot dogs, that is no good. Well, we want to try to prevent any type of cancers from coming alive. You know, if we have something that's dormant, we want to keep our cells and the environment in which the cells are living as clean as possible. And that only comes from the type of foods that we eat. As we know that a lot of those processed meats have nitrite in it, which is definitely no good. It causes inflammation and it can also cause certain type of cancers. Excess red meat, okay? That's another one. Fried and ultra-processed foods. We can't have that all the time. Okay? Some people actually have a diet of having fried foods and ultra-processed foods every single day. I had a friend one time, believe it or not. I had a friend that ate McDonald's for breakfast, for lunch, and for dinner. And some people do that because some people may not cook that much at home, or maybe they don't know how to cook, right? So they go and they eat this type of way. And I can guarantee you, do that for a year, and you're sure to have something come up in your body, some type of situation that's not going to be helpful to your health. Okay? It has been proven, ladies. So please, I'm not saying that occasionally you can have something, you know, maybe a piece of fried chicken from time to time, right? I'm not saying cut out everything and never have it again. I'm just saying that you want to keep a diet of 80-20. 80% healthy and 20% occasional little snacks that you want to have. But you never want to have it the flip way around. That will be no good for you. Refined sugar and white flour products. I've talked about that many times. Cancer, for instance, loves sugar. Okay? It sometimes can help it to grow, depending upon the cancer it is, and also your body. So that's something that you don't want to have too often. And of course, excessive alcohol. We talk about that all the time. So you should pretty much know, listening to this podcast, where I go when taking back your plate and the good foods and the bad foods that you need to stay away from. And depend upon conditions, some things may be more than others, right? So it's just important that we understand which is best for us. Now, there also are some supplements, but again, I'm going to mention a few supplements here, but I'm not saying that, taking these supplements alone will do the trick, especially if you're having symptoms. These are preventionary things that you can do to help your body to stay healthy, to help your cells to stay healthy for prevention. But if you start to have any kind of symptoms that I just mentioned, you definitely also need to see a licensed professional so that they can see what's going on, okay? And if you're taking medicine, again, you want to make sure that the medicine that you're taking will not affect you taking these type of supplements, right? Because sometimes it can. So you always want to double check on all of these things first. That's being responsible. But if you can, vitamin D, okay? And this is linked to lower risk in some studies of gynecological cancers. Vitamin D is a very important vitamin, okay? It's usually not linked to too many contradictory things with medicines, but it can still be linked, right? Because sometimes, depending upon the strength of the vitamin, can either cause the medicine to not work as effective or over effective. So that's why, again, it's a delicate balance, right? But if you can do it, definitely. Omega-3, which is, of course, fish oils, very important. Curcumin, which is turmeric extract, very important. And you can cook with this as well. Okay? Green tea extract. Resveratrol, which is an antioxidant from grapes and berries. Now, resveratrol has been known to be very good for anti-inflammatory, antioxidants, okay? And because of its high level of the auric factor, it has at times been very helpful in prevention of some cancers. And probiotics, which help to support your gut and your immune health. Okay? And we're going to be talking a little bit more about your gut and probiotics, because that is something a lot of people have problems with. And us ladies, because we tend to have a lot of stress and we tend to have it a lot of times in our gut. What can we do about that? We can sometimes have diarrhea. We can sometimes have constipation. We can have problems when it comes down to our gut based upon our stress levels. So I definitely want to cover that soon, okay? But taking a probiotic is so important, okay? Because your immune system and your gut are tied together. Most of the time, if your gut is overproducing too many bad bacteria, I was just about to say hormones because I always talk about hormones. If your gut is producing too much bad bacteria, it's going to affect your immune system, which is all together in the gut. So that's why we call the gut our second brain in the medical profession, because it is. So many things is made inside of the gut So if that's unhealthy, it pretty much is a precursor for everything else to be unhealthy. But if we have a good system where we're producing just amount, we're going to have some bad bacteria, but we shouldn't have an overgrowth. So that's why it's important to take probiotics, because it will support your gut and it helps your immune system. Okay? All right, ladies. So now we're going to talk about a nice gift of a smoothie that is going to be nutrition packed, and it's our cancer defense green smoothie. Okay, so we want to do 1 cup of kale or spinach, a half cup of blueberries, a half cup of pineapple, 1 tablespoon of ground flax seeds, which gives that omega-3 plus the fiber, 1 teaspoon of turmeric powder, plus a pinch of black pepper, which is anti-inflammatory boost. And what happens with that is the turmeric and black pepper need to work together for it to work its best in helping with inflammation. And we're going to do a 1/2 inch of fresh ginger and a cup of unsweetened green tea, which is cooled. We want to go ahead and blend until smooth. And you also can use almond milk if you like. We want to blend until smooth. Now, this smoothie supports detoxification. It reduces that most important inflammation, and it floods the body with antioxidants, which is extremely important because we don't want our cells to get oxidative, right? You ever had an orange that you left out, especially if it's humid in your home, and it starts to get like that charcoal, black, grayish look? That's how your cells look. That is actually how your cells look when it starts to become in that type of state. So we want to be antioxidant. We don't want it to be oxidative. We want to be antioxidants. And that is how we keep the cells healthy, viable, and prevention. Okay? All right. Now, I want to kind of talk a little bit about also a 3-day anti-cancer prevention meal plan. I just want to give you a little glimpse of what that can look like. Because sometimes when I talk about, I like to give the gift of a smoothie or a juice or maybe a recipe so that you can get started immediately on whatever I'm talking about. But sometimes I also want to provide just a glimpse into what it can look like. Because sometimes you may think it's going to be hard to have this type of lifestyle, to have a lifestyle of, eating better for yourself, eating better for preventionary measures. But I want to show you how simple it actually can be. Now, you can take this down if you like, or you can listen to it again, or you could just hear it and see and get an idea of what a typical day will look like. So, the smoothie that I just mentioned, let's say day 1, you would do a green smoothie, the one that we just talked about. And this would be in the morning. And you would do a boiled egg on the side for extra protein. Okay? And then for a snack, you will do like a handful of walnuts plus green tea. Again, that's if you can do the green tea. Okay? And then for lunchtime, you would do a bowl of quinoa. And you would have that with roasted broccoli, Brussels sprouts, and carrots. This is how you are allowing the crucifix's food. Sorry, I can't talk today. I'm just kidding. I like to play with you guys because I love having fun. The crucifarius food. This is how you incorporate it into your daily lifestyle, your daily meals. This is how you do it. Okay? So you can have that. And then also some chickpeas. And if you want to use a tahini lemon dressing, you can. And for a snack, you can do apple slices with almond butter. Okay? And for dinner, you would do the wild salmon. It could be, or you maybe could do a grilled tofu if it's plant-based. steamed spinach with garlic, and sweet potato mashed potatoes with olive oil. That's day 1, okay? Day 2, I'm giving, again, this is just ideas, guys, because again, I'm talking to you how you can take back your plate. And I give you what you need to take, what food you need to eat, and what food you need to stay away from. But what I wanted to do today was show you or give you a glimpse into what that looks like, how to incorporate these different things in your daily meal. So let's say for day 2, your breakfast can be overnight oats made with almond milk, chia seeds, flax topped with raspberries and pumpkin seeds. Okay? And then for a snack, you can have edamame sprinkled with sea salt. And then for lunchtime, you could do lentil and vegetable soup, which can have tomatoes, carrots, celery, kale, onions, and garlic. You see how you are incorporating the things that I'm talking about, the foods that you need to eat, how you can incorporate this into a daily meal plan. And also do a side salad with olive oil and lemon. And then for maybe a little snack, you can have a berry mix of blueberries, strawberries, and blackberries. And for dinner, you can do grilled chicken or tempura. You could do cauliflower, rice, stir fry with turmeric, ginger, and mixed veggies, and a side of avocado slices. And our last day meal plan suggestion, we can do for breakfast a smoothie bowl, which we can have for the base. We can do frozen berries, spinach, flax, and sweetened almond milk. And we can top it with the chia seeds, the hemp seeds, and a few slices of kiwi. Yummy. I wouldn't mind having that now. And then for a snack, you could do carrot sticks with hummus. And then for lunch, you can do some wild rice and black beans salad with corn, red pepper, cilantro, and lime, and side of steamed broccoli. And for your snack, you could do like a handful of Brazilian nuts, which is rich in selenium for cancer protection. And for dinner, you can do a delicious baked cod or lentil patties. You can do roasted asparagus, zucchini with olive oil, and quinoa with fresh parsley. Now, some of the key features that I'm mentioning in this, first of all, having high fiber helps to remove excess estrogen and supports detoxification. And I'm going to get that in your head to the point you're going to be like, I got to detox, right? Because it's so important. And then your antioxidant-rich berries and greens and cruciferous veggies. And then the omega-3s, which is the flax, the walnuts, and the salmon. And low inflammatory foods. You want to, like we said, avoid the sugar, the processed meats, and the alcohol. And then you have herbs and spices like turmeric, garlic, ginger. These all help to boost your cancer defense mechanism in your body. So I just wanted to give you that as an example because, like I said, I'm always telling you, what are the foods you need to eat and what foods you need to stay away from. But what does that look like if you were to include that in your everyday meal? And you see, it's not so hard after all. It is not so hard after all. But if you continue to eat like this, be mindful of this. And of course, occasionally you can have a little something like maybe a piece of cake or a piece of pie from time to time, but not every day. We want to always think about prevention, ladies. Always think about prevention, right? And we think about prevention by taking back our plate. So we covered a lot of great things today because September, since we're almost leaving out of this month, is Gynecological Cancer Awareness Month. So I wanted to make sure and cover what does that mean. We covered the different forms of cancer in our reproductive area. We covered about screenings. When is it time to screen? Okay, and some of the testings that will be done in that particular time of screening depend upon the type of cancer. Of course, we talked about how we can take back our plate And what are the things that we need to stay clear away from? We, of course, talked about when is the time to see the doctor, some of the symptoms that you may have that you want to watch out for, and the testings that the doctor will do, and some of the also treatment that's possible. It all depends on the decision that your team of doctors make based upon your medical history and also what currently is showing up in the testings. And we talked about how we can incorporate a delicious cancer defense smoothie for preventionary measures. Drink that in the mornings on an empty stomach, like I always mention, so we can get those nutrients to work right away. We talked about supplements that you can take that helps with prevention when it comes down to cancer. But we also talked about the importance, if you're taking medication, to make sure that you can take those supplements, right? We want to always be responsible. And lastly, we talked about what does it look like for a 3-day meal from morning to snack time, to lunchtime, to dinner. What does it look like to incorporate some of the things that we need to eat in a daily lifestyle? So again, guys, be proactive on your health. Always be proactive on your health. Don't wait until something happens, okay? But make sure you get your screenings. Make sure you get your proper your physicals that you need to have each year. Depend upon, sometimes it could be every year, maybe every 2 or 3 years. It just depends on you and the decisions that you're making with talking to your healthcare provider. Okay? But we want to be responsible and most importantly, be in tune with yourself and your body all the time. So this way we can prevent these things from happening. Right? But we can help. We can help these things from not happening if we take the necessary steps by taking back our plate. Because nutrition is definitely the way to help us in prevention. Okay, ladies. Now, if you want to dig a little bit deeper into any of those things, if you have a family history of gynecological cancers and you want to be proactive in your health, I can be your partner. I would love to be your partner in getting healthy. So go to www.nutritionudesign.com. I do offer 30-minute consultations, which are free. Okay, you can book it with me, and then we can take it from there, how we're going to proceed further. But I can test for so many great things when it comes down to genetics, when it comes down to regular testing, when it comes down to toxic overload, nutritional deficiencies. I have over 200 panels to really get you healthy. So I'm a health detective. I'm like a detective. I'm a health detective for you, for only you. Okay? And I can create that customized meal plan based upon your results. Okay? So that you can really get to the bottom line of what's going on. Okay? And I love what I do 100%. And I carry those supplements. I mentioned a supplement DIM, D-I-M, that basically has the cruciferous vegetables inside of it, right? So sometimes if you can't always eat the food, of course I'm an advocate of that first, you can take the DIM, which is a tablet, and it does the same thing. It helps to detox excess estrogen. And I have practitioner-based DIM, right, that you can't get in the stores, along with well over 300 other type of supplements that you can't get in the stores. So definitely, even with that, I can help you with that as well. So go to www.nutritionudesign.com and let's work together. Let's work together. Let's not be waiting for something to happen. Let's be proactive in our health for preventionary measures. Okay? We covered a lot today. Whew. So, I always say, your health is your wealth. That's another important thing. Because you know what? You can be a trillionaire. If you're not healthy, you're not going to be here to be able to spend not $1. So care more about focusing on you and your health first. I also let you know that wellness is not just a focus, it is a lifestyle, because it is. Lifestyle nutrition is what I call it. Not so much about a diet. It's about lifestyle nutrition. Because if you do lifestyle nutrition, you're always going to look to eating healthy. You're going to always look to take care of yourself and do the right thing. Okay, ladies. So with that being said, next week would be October. So we will talk about some other health awareness things in October and other different things, but we'll at least end this month here of talking about a very important topic for us ladies that we need to definitely address. And I did not want to leave this month without discussing it. I hope that you have a fantastic rest of the day wherever you are, and more importantly, a fantastic rest of the week. Until next week, and to another great episode, please be sure that you take care of yourself, and don't forget to share this podcast. Please, guys, share it to your friends and family, other ladies that you care about. I've covered a lot of great topics, and I want to continue to cover great topics for you to help you to be healthy, okay, and to take back your health with the power of your plate. So with that being said, until next time, I will see you soon.